Hi, my name is Beeran Meghpara, and I am a cornea, cataract, and refractive surgery specialist at Wills Eye Hospital in Philadelphia, Pennsylvania. As far as treatments for dry eye disease, I think the gold standard is anti-inflammatory medication. We all know now that dry eye is an inflammatory disease. And in this space, there's been a lot of breakthrough recently. Dry eye is becoming more and more of a popular topic to talk about. The awareness of dry eye has been going up, and we do have a lot of new medications out there. So there are long-term medications like topical cyclosporin and lifitegrast that provide long-term inflammatory control. And again, we know dry eye is an inflammatory disease, so this is really important. What's taken off more recently is the use of topical steroids. For a while, a lot of us cornea specialists were using corticosteroids to treat dry eye kind of as a norm, but now that we have a couple of indicated or FDA approved treatments when it comes to steroids in the dry eye space, I think that they've become more popular and they will continue to become more popular. So the two that are out there that are on label for the treatment of dry eye is Flarex, which is fluoromethanol acetate, as well as Isuvis, which is loteprednol. And these two are meant for episodic flares of dry eye. So for example, you have a patient on, a long-term, for example, cyclosporin, and they may have these breakthrough dry eye symptoms. That's a nice space to use steroids. So I think the use of steroids in dry eye is going to go up and up and up. Now, what about treatments that don't use drops? So there is something out there that's coming down the road, and it's basically a nasal spray that's going to be developed by Oyster Point. And what it is it's a way to stimulate the parasympathetic nervous system to basically stimulate those nerves and increase tear production. So it's basically a way of treating dry eye without putting drops in the eye. And for a lot of our patients, that could be a big plus. Dry eye typically affects patients that are a little bit older. They may have more difficulty putting in drops in the eye. Just, the appropriate reception of actually getting the drop in the eye could be tough. Sometimes arthritis, they can't squeeze the bottle. So this is an alternative by using a nasal spray to treat the signs and symptoms of dry eye. The million-dollar question is, are patients going to like using a nasal spray? Sticking something up your nose for some may not be the most pleasant thing in the world, but it is exciting to see what the final results are and how it kind of plays out in the marketplace. Now, when it comes to lifestyle, there are a lot of things that we do on a daily basis that does make dry eye worse. Now, first and foremost, we do have to think of the underlying problem, which again is inflammation. So dry eye, again, is an inflammatory disease, but there are things out there that can exacerbate it, that can make it worse. First and foremost, sleeping. A lot of times patients don't sleep with their eyelids completely shut. So what happens overnight, if the eyelids are even just a crack open, tears can evaporate away from the surface of the eye, and patients wake up with really, really dry eyes, especially if they use a ceiling fan. So anytime someone comes in with dry eye, I always ask them, you have a ceiling fan? If they say yes, I ask them, well, can you do away with it? Because maybe that may be making your dry eye worse. Dry air, depending on what part of the country or world you live in, certainly can make dry eye worse. Humidifiers, I'm a huge proponent of humidifiers. The indoor air humidity is quite low. Even in the Northeast where I live, the summers can get quite hot and humid, but in the winter, it's really, really dry. So I've got my humidifier running. I have dry eye myself. So I've found that when I bought a humidifier, it really helped. I would say the biggest kind of lifestyle thing that affects dry eye, especially in 2021, is screen use, computer use, smartphone use. What happens is when you're on these devices, naturally, we blink less. When you're staring at something like a computer screen, your blink rate goes down. And the more and more we do this, the more and more our tears are evaporating away. So I do encourage all my patients, if you're doing a lot of screen time, if you're on the computer all day, just take a break, maybe every hour for a few minutes, shut your eyes maybe for 30 seconds, kind of do a lot of forced blinking. So a few times every few minutes, just kind of squeeze your eyes shut like that. Not only does that kind of coat the surface with tears, it also helps secrete meibum from the meibomian glands. So, but I think that the key is just don't overdo it. Just like anything in life, don't overdo it, take breaks, and try to limit screen time as much as possible.